My name is Dr. Ahmed Yacoub. I am a German-trained orthopedics and sport medicine doctor. I deal with sport-related injuries as well as with joints and muscle issues. We'll speak today about the shoulder impingement syndrome, which is one of the most common causes of shoulder pain. The human shoulder is built up of three bones: the collarbone, the upper arm bone, and the shoulder blade bone, as well as associated muscles, tendons, and ligaments. The space between the acromion, which is the shoulder roof, and rotator cuff is the subacromial space. This space is very important for us to be able to rotate and move the arm in all directions. The impingement syndrome is a narrowing of this space due to injuries, inflammations, or bone deformities. In order to confirm the diagnosis of shoulder impingement syndrome, we usually perform X-ray, ultrasound, and MRI to rule out any other injury of the shoulder. The first stage of the treatment of the shoulder impingement is to give the patient a course of anti-inflammatory medication and sometimes muscle relaxants, followed by some physiotherapy sessions to improve the coordination of the muscles and flexibility of the shoulder. In some cases, surgical treatment is required, especially if we deal with a bone deformity which cause friction between the rotator cuff and the bone, which might lead sometimes to rotator cuff injury. If you need to have a surgery on your shoulder because of the impingement syndrome, we usually perform a small minimal invasive procedure, a keyhole procedure, to remove the inflammation from the shoulder space, from the subacromial space, increase the space and make it possible to move the arm in all directions without friction with the bone or inflamed soft tissue. The patient will be able, one day after this procedure, to move his arm and to start with the physiotherapy, and will be able to go to his daily activities and sport activities after 2 weeks from the procedure.